the Committee of the Whole House on the State of the Union for the consideration of H.R. 1309. The chair appoints the gentlewoman from Texas, Ms. Jackson Lee, to preside over the Committee of the Whole.
The House is in the Committee of the Whole House on the State of the Union for the consideration of H.R. 1309, which the clerk will report by title.
A bill to direct the Secretary of Labor to issue an occupational safety and health standard that requires covered employers within the healthcare and social services industries to develop and implement a comprehensive workplace violence prevention plan and for other purposes.
Pursuant to the rule, the bill is considered read the first time. General debate shall be confined to the bill and shall not exceed 1 hour, equally divided and controlled by the chair and ranking minority member of the Committee on Education. The gentleman from Connecticut, Mr. Courtney, and the gentlewoman from North Carolina, Ms. Fox, each will control 30 minutes. The chair recognizes now the gentleman from Connecticut.
Thank you, Madam Chair. I yield myself as much time as I may consume.
Gentleman is recognized.
Madam Chair, today's vote on H.R. 1309 is an important milestone in what has been a 7-year process of getting the Occupational Safety and Health Administration to effectively act to protect the healthcare and social service workforce from skyrocketing rates of violence. Sadly, in America today, nurses, doctors, social workers, EMTs, and nursing assistants are more likely to be the victim of on-the-job violence than any sector of our nation's workforce. This violence comes in the form of assaults, kicking, hitting, choking, and spitting from patients and residents and clients or those who may accompany them. It affects a worker's sense of duty, of safety at work. It contributes to burnout, absenteeism, high worker compensation costs, and stress. Tragically, it can also lead to death. According to the Bureau of Labor Statistics, healthcare and social service workers are more than 5 times as likely to suffer a serious injury from workplace violence than workers in other settings. And this chart, which shows the red line of healthcare workers versus other sectors in the U.S. economy, vividly, powerfully demonstrates the data that's coming into the Department of Labor on this issue. In psychiatric hospitals, that number is drastically higher. In a recent survey, nearly 50% of emergency room physicians report having been physically assaulted at work, and 60% of those who have these occurrences said they happened in the past year. As this graph shows, these numbers are on the rise. The incidence of violence in workplace has increased 80% over the last decade. Since OSHA has not effectively addressed this emergency, this bill is necessary to ensure that a standard is issued and enforced in a reasonable period of time. Using past precedent, the bill calls for an interim final standard within 1 year and a final standard within 42 months. The public comment and rulemaking process is preserved in the development of the final standard. Very simply, the standard required by the bill would require that covered employers such as hospitals and psychiatric facilities develop a workplace violence prevention plan that is tailored to the specific conditions and hazards present at each workplace. It is not a one-size-fits-all requirement. Mr. Chair, Madam Chair, developing a plan is not rocket science. For over 20 years, OSHA has published voluntary guidelines on violence prevention that include common sense measures such as training staff about how to identify high-risk patients, share the information with coworkers, not be alone, and ways to de-escalate threats. We know from the Joint Commission on Hospital Accreditation that these measures work. And the problem is, though, that there is no consistent enforceable standard to ensure their application, and that is precisely what this bill does. While we will never eliminate all risk or stop every violent attack, research on the measures in this legislation have been shown to substantially cut the incidence of serious injury from workplace violence. The nurses, doctors, social workers, and EMTs who care for us in our times of crisis and need deserve to have these protections soon, not in 7 years and not in 20 years, as is likely if we fail to pass this legislation into law, leaving OSHA rulemaking to its own dilatory, almost comatose devices. I would like to thank the large coalition of healthcare professionals, their organizations, also union representation who have diligently fought for these protections protections for years. To Subcommittee Chair Alma Adams, the Workforce Subcommittee on Education and Labor, Chairman Bobby Scott for their leadership, and also to Richard Williams and Jordan Barab, our committee staff who've done amazing work, as well as Maria Costigan from my personal office, who have just worked night and day for years to try and get us to this point. And with that, I reserve the balance of my time.